Hi, I'm Dr. Ricky at the Montague Clinic. We are really proud to be offering the antibody test for COVID-19 at the Montague. There's been a lot of talk about these tests, and so I thought it'd be really useful to do a bit of an explainer video just to make sure that if you're going to get it, you're doing it for the right reasons and you understand what the result means. So, first of all, what are antibodies? Antibodies are a protein that your body produces in response to an infection. Then they normally, or in some conditions, would indicate a level of immunity. However, in COVID-19, we don't know enough about this condition yet. The presence of antibodies will tell you whether you've been exposed to COVID-19 in the past, and what they don't tell you is whether you actually have confirmed immunity to COVID-19. It's really important to know that if you have antibodies, it just shows that you've been exposed, but it doesn't necessarily infer that you're protected. So why should you get it? What's the point? Well, we do have a few people who just want to know. It's a bit like when you want to know what your blood group is. It doesn't really change what you do in life, but you just kind of want to know whether you've been infected, or was it that time when I was unwell a few months ago? Was it COVID? Was it not? It may help to explain a previous illness, or it will tell you whether you've been exposed to it in the past. But again, it doesn't necessarily tell you whether you are immune to COVID-19. So let's talk a little bit about testing in general. This has been in the news loads, the landscape's changed loads, and it's really important to know which type of test to go for. So initially, the big wave of antibody tests were the pregnancy style test, the ones where you take a little bit of blood at home, pop it on a little kind of cartridge, and it will tell you a yay or a nay as to whether you've got COVID antibodies in your bloodstream. These tests categorically at present are not valid. There's been lots of stories about the accuracy data of these tests. They're giving positive results when they shouldn't, the other way around. We just don't recommend at this moment in time, today's the 1st of June by the way, to do that type of test. So the second wave was a laboratory type antibody test. These are much more accurate, but only 2 laboratory tests have been validated by Public Health England, so by the company Roche and by the company Abbott. Now, we're going to be using the Abbott test. So then there was a big wave about how to get that test done. So lots of companies were selling finger prick tests where you take a little drop of blood at home via finger prick. You can send it off to the lab in the post. The lab would do a laboratory test and you'd find out whether you had antibodies or not. Last week, on the 27th of May, the MHRA, who are the regulator for medicines, have put a pause on that type of test because they're just not sure whether they're actually valid. So at this moment in time, on the 1st of June, the best way, or the only validated way of finding out whether you've got antibodies to COVID-19 is to have a venous sample, so a blood test, a proper blood test, and the laboratory analysis must be by Abbott or Roche tests. So just whether you come to us or not, please just make sure that you're getting a venous blood sample by Abbott or Roche. As that changes over time, it no doubt we will do another explainer video to keep you updated, but for the moment, these are the only 2 ways of doing it. And because of that, it's become really difficult to get the antibody test because you need to have a safe way of getting your blood taken, and the right test needs to be done in the lab. So what we've done is our normal clinic at 4 Basinghall Street has closed for COVID, and it will be reopening in the coming weeks. Again, we'll keep you updated about that. But we've set up a satellite service at Mansion House Dental Practice, where we'll only be doing COVID-19 antibody tests, and we're doing it in a way where we're using PPE, social distancing. I'm afraid if you've got symptoms of cough, lack of smell or fever in the past 2 weeks, we'd ask you not to book an appointment with us, and you're welcome to email us to discuss that and a way forward with that. But yes, so just in summary, we are offering a venous sample blood test using a validated method of discovering whether you've got antibodies to COVID-19. This result should not change your behaviour. You should still be adopting social distancing measures. You should still be listening to government advice. It doesn't mean that you're immune if you have antibodies. It just means that you've been exposed in the past. You have developed a little bit of an immune response, but it does not offer you protection to COVID-19. Just not enough is known about COVID-19 at present to know that. So we need to be just really clear that everyone understands what the result actually means. So if you're interested in getting a test done, the link should be in this post. If you click on that, you'll be able to see the slots that are available. And if you go ahead and book, you'll get a confirmation email with all the details. Any other questions? Just email us at info@montagueclinic.com.